Applestosen. It's Dr. Bob here with another health and vitality solution tip of the week. This week's topic is fibromyalgia, also known as chronic fatigue syndrome. The challenge with chronic fatigue or fibromyalgia is that it is a very debilitating, painful situation for millions of people. The challenge is a lot of these people that are in a lot of pain go to all different types of doctors, from psychiatrists because they were told they were crazy, to rheumatologists that they think it's an arthritis type of problem, to pain management centers where they get over-medicated, to actually people having surgeries. A few years ago on Dateline, they had a interview with two specific patients that had undergone a new procedure. One of them was a neurologist, and what they'd done is they'd found that a lot of the problems with fibromyalgia or chronic fatigue is a problem with the central nervous system. And they found that at the base of the skull and the top two vertebrae that there was pressure that was developing at that period or that place in the spine, and it was causing these debilitating symptoms. And I was watching this show and I was thinking about, well, that's a chiropractic problem because the upper cervical is not in place. And as this neurologist was talking, he was saying that, yeah, he was, led a pretty much perfectly normal life until he had fallen off of this horse. And I mean, lights go off, okay, he's fallen off of a horse, he's caused trauma to his neck. And yet, he had never seen any type of chiropractic care. The surgery that they did on it was a miraculous thing for him. What they did was they cut the back of the skull off and the back of the top two vertebrae to remove that pressure. Now, the fall off the horse caused the spine to shift. That's subluxation. Subluxation is a lowered energy condition. Lowered energy in the body creates chronic fatigue, chronic pain problems, especially at the most important part of your nervous system, at the upper cervical, where the brain and the spinal cord hook together. Another person that they'd interviewed that also had miraculous results with this treatment that they were talking about on Dateline said that she was in a car accident just 6 months before. T-bone from the side, shifting the neck, and you could see her head posture was like this, and the shoulder was dropped. Same thing, they did the surgery and miraculous results. The challenge is that's a permanent problem that was created from a trauma, and they did a permanent surgery that weakened their neck. In fact, they had to wear, if they went out driving, they had to wear a neck brace in case they ever got in an accident again, because they could be paralyzed from the neck down. Well, chronic fatigue syndrome is actually a multidisciplinary type of problem. But you've always got to look at the cervical spine and the spine itself. If you look in the mirror and you see a shoulder dropped and your head shift off to one side, that's creating a tremendous amount of stress on the upper cervical area. That causes your body to be in a state of breakdown and rather than healing repair. Correcting the alignment problem, correcting and bringing your shoulders back up to level, centering the head over the spine, takes a tremendous amount of stress off the spinal cord. Right where the brain and the spinal cord hook together is one of the most important parts of your nervous system, and if you have a head shift or some sort of tilt, you've got constant bombardment for these muscles to be always on as opposed to just moving the body like it's supposed to. So as a chiropractor, our main focus is to look at your spine, your nervous system, your posture, and your daily activities. Then we also might look at activities of how you're eating and your thought processes, because that can put stress on the upper cervical area. If you have toxicity, that can cause stress on the central nervous system also. So the topic of the day is fibromyalgia and chronic fatigue. If you or somebody that you know or loved ones has this diagnosis, fibromyalgia or chronic fatigue syndrome, look at their posture. It's a very simple check. If they've got a head shift off to one side and a shoulder tilt, they may have a spinal alignment problem that needs to be corrected. And that could be a lot easier than a surgery that is a permanent correction to a permanent problem. Have your loved ones get checked and see if chiropractic care could be the solution to their long-term chronic fatigue and fibromyalgia. Until next time, it's Dr. Bob, Applestosen.